Yeah, my name is Anna Beltran. I work with Generations United, which is a national nonprofit in D.C., although I work out of my home about 20 minutes away. And we have had a national center on grand families for about 20 years. So we do a lot of kinship care and have for a very long time. And we've been following these Kinship Navigator programs since they started popping up. And we really try to spread the word about them because we think they are fabulous resources for the families. So I'm delighted to be with you all today. And if at any point you have questions, please raise your hands. So I'm going to talk about 3 opportunities today, because there are 3 federal opportunities, basically, and can get a little confusing because the timelines are close together. But I'm going to start with the big one, which is the Family First Act. And that opportunity is for ongoing federal reimbursement for Kinship Navigator programs that meet certain evidence-based standards. And under Family First, which is a huge step forward for grand families, and you can go there if you want to see the whole law, you can, as I say, get 50% for these navigator programs for ongoing maintenance of the programs. But they do have to meet these evidence-based standards. And we're going to hear about various programs later and how they're meeting those standards and how they're working to meet those standards. But the great thing about these Kinship Navigator programs is they're not limited to the 4E children. They're not even limited to the children in foster care. This is for everyone. And this is why they're such a great resource for states and tribes. So what are the requirements under federal law? Well, there are those evidence-based standards that we heard quite a bit about this morning, which I won't repeat. But there's also, you have to adhere to the requirements that were under the Fostering Connections Act, which started giving a few federal grants out back in 2008 and 2012 to kind of pilot these Kinship Navigator programs using federal funds. And they were very successful, and that's why we've got this pot of money now for everyone who can get there. Now those grants, those 2 rounds of grants, they didn't have to meet evidence-based standards, but they did have to do all these other things. And so will programs that can get the ongoing maintenance, can get the ongoing funding for the maintenance of these programs. So you can read it, but they've got to be coordinated with basically what's out there already. And that's what we know works best, right? Tap into the community organizations, the nonprofits that already do this work, that already work with the families, that know the families best. Operate them in consultation with kinship caregivers. And we know that peer kinship caregivers are just such an incredible resource for the families. You know, having other grandparents and relatives who are raising children actually serve as the kinship navigators can be a very useful thing. Have information and referral systems. And here you can kind of build on things that are already in your state, perhaps, because under the National Family Caregiver Support Program, since it's been around for 18 years or so, many area agencies on aging have been doing that similar kind of work to this, and contracting with local providers. So you may be able to tap into them, to use them to be navigators as well. So there are lots of opportunities, hopefully, within your state. Why isn't that clicking? Absolutely. Very good question. So that is totally up to the states, really with respect to everything. With respect to the guardianship assistance program, with how you define relative, how you define kin, how you define victim kin. Yes, it's up to the state. So have to have outreach, have to have materials, have to have a website, you know, just kind of all these kind of no-brainers, right? But really do work with those who are out there. That's really what the feds want to see. And you can also use the money to have kind of an ombudsman. It's kind of a person that's, you know, a central point. And all these requirements are in the U.S. Code, as I said, as part of that Family First, as Fostering Connections Act, which the Family First incorporated. So that's one opportunity, and that opportunity starts October 1 of this year, so before the prevention services that kick in next year. So this is a totally separate thing with separate requirements. And you can start getting money very early on. Well, now how do you do this if you don't have an evidence-based program, which almost nobody does? This is how you do it. And am I going backwards now? Okay. You apply for these magic funds. So this is the second opportunity I'm going to talk about today. These funds that were separately appropriated as part of the omnibus budget about a month after Family First was enacted. And these monies can be used to develop, enhance, or evaluate your program. So, like Washington State can be using it to evaluate. Another state that doesn't have such a program can start from scratch, hopefully using other program examples that are out there, right? So, oh my goodness. This is my first time using this thing as my clicker, so I'm a little bit. These are the program instructions and all the directions required to apply for this fiscal year 2018 funding. It's really very straightforward. This is not a competitive process. This is just fill out the application and we will allocate your money to you. And you can ask for more if you can make a case for it in your narrative. So I encourage, because some jurisdictions may not apply for this. So if you can make a case for more money, make the case and apply for more money. You will see it's $20 million for all the states, so it's a significant amount of money. There's no matching requirement, and you don't have to meet any of those evidence-based standards to get this money, but you need to be working towards meeting those standards and requirements that I just went through in addition to the evidence-based. I'm going to walk you through the allotments. Oh, good grief. Did that go back again? No, this is a new slide. All right, so this is basically what I just told you. In addition to the fact that the funds have to be obligated by September of next year, by the end of the month, September of next year. So these are just one-year funds, but they can get you off the ground. And then if you can get your program evaluated, then you can start using that Family First 50%, right? So here are the allocations. So you can see it's quite a bit of money. Texas, for example, has allocated over $1 million. This is based on population, right? So, and you can ask for more than that. So keep that in mind. And the next slide is the tribes. And again, they can also ask for more. So keep that in mind, because it's a lot less money. So the third opportunity I'm going to talk about today is what Commissioner Miller mentioned this morning. So this Federal Register notice just came out about how are we going to do this evidence-based stuff, who's going to be in the clearinghouse, how are we going to do the clearinghouse. It's just a 3-page notice, but it gets into a lot of nitty-gritty. And Generations United is looking at it with the kinship lens. And what we have really come away with is that kinship navigators really need to be treated differently in that Federal Register. They need to have a different section even, because there's so many different requirements that we're kind of getting lopped into preventative services where the Federal Family First Act really didn't put us all together, right? So for example, kinship navigators, like I mentioned earlier, can serve a broad range of families. They're not limited to these candidates of foster care or children at eminent risk. So let's not lump them in there in the federal notice, in the Federal Register, in the evidence-based requirements. Also, they do not have to meet that 50. I know this question was asked of Commissioner Miller this morning, and he kind of, said he kind of hedged his answer, right? But the law is really quite clear that the 50% does not have to meet the well-supported standards. Like we talked about this morning, there are 3 tiers: promising, well-supported. What's the middle one? Supported. So for the preventative services piece, right, that has to, 50% of that has to be well-supported, so the highest evidence-based standard. But that does not apply, at least as Family First is written and intended to be written, to the Kinship Navigator piece. So that's another area where it's different, and we don't want to be kind of lopped into that as part of this requirements. Further evidence. So our navigator piece becomes effective as of this year, right? October 1. States can start getting funding if they can meet the evidence-based standards, whereas preventative services don't start until next year. So there's also a time difference. The navigator programs are 50%, whereas prevention could actually go up further based on your FMAP. So that's another difference. And then the eligibility for the navigator programs, for the funding for that 50% is not tied to when you implement the congregate care provisions, whereas it is for prevention. So you can ask for a 2-year delay to implement the congregate care provisions of Family First, but if you ask for that 2-year delay, then you can't tap down prevention services for the same 2 years. But that whole time thing does not impact Kinship navigators. Does that make sense? So those are basically the 3 big opportunities. The Family First, which is ongoing money for every year from here on out, till they change their minds. The fiscal year 2018 opportunity, which isn't tied to the Family First requirements and is real opportunity and in very easy forms. They're all linked on those slides. And we have all these resources as well on grandfamilies.org. And so you can get all that stuff from there. And I'm happy to be a resource to connect you with the right things and hopefully some good program examples, which I'm going to give you right now. The first one I'm going to mention is, oh no, that's right. The first thing I'm going to do is point out a few lessons learned from the existing navigator programs, which is there are a variety of programs around the country. We know of about 70, and we have a chart of all 70 here at grandfamilies.org. There are a few lessons learned, which is that generally speaking, of course there are exceptions, it's better not to house the Kinship Navigator program at the Child Welfare Agency for obvious reasons, right? Trust issues. And also, if it's at the Child Welfare Agency, all those families that you can serve that are outside the Child Welfare Agency are unlikely to come to the Child Welfare Agency, right? So, and there are 20 children with a relative outside of foster care for every one in foster care with a relative. So there are many, many more that we can serve outside the system. So you limit your reach if you just have it at the Child Welfare Agency. Also, a combination of peer-to-peer, so really having grandparents and other relatives who are walking the talk, provide some navigator services, and having a combination with degreed professionals who can perhaps provide some mental health services, some other wraparound services. So having that combination, and really not just being a phone line, right? But having people like Cheryl and like Lynn who walk you through it, right? Or Cheryl, I guess it's the people you supervise, right, Cheryl? Yeah. Strategies. How can we build on this? There are some state fact sheets that we just updated last year, along with a number of other national partners, including Casey Family. And these are fact sheets that theoretically identify the kinship services in your state and programs like at the community level that are really help these caregivers. So that can be a place where you can kind of connect with people on the ground who are already providing these services, and you won't have to reinvent the wheel in your communities. We were just on a webinar, Lynn and I, last week where we connected a caregiver advocate in Virginia with her state, and so they're talking now. So it's a way to kind of figure out who you need to talk to. Work with programs that serve grandfamilies. Obviously, that's what we're talking about. Another helpful tip is, which I'm sure you all thought about, is that the schools of social work in your communities are often very good sources to evaluate these programs, and perhaps can do it at slightly less expense. And individualize your data reports from your providers. So there's concern out there that there'll be this pot of money, particularly in fiscal year 2018, that just kind of gets mixed in with other funds, and Kinship navigators don't really get off the ground. So by requiring your providers to individualize their data, we serve this many families with navigators, that there'll be less likelihood of kind of aggregating the money into other pools, right? So the first program I want to highlight is from Florida. And this was one of the 2012 Fostering Connections grantees that I mentioned earlier, that didn't have to meet the evidence-based standards of now, but did have to meet those other requirements, those two pages of slides that I went through. Anyway, this is, they're very close to meeting the well-supported evidence-based standards, and they've been working for a long time with a number of evaluators. And how this navigation program works is they have this 1E application. This means a peer kinship navigator. So another grandparent or other relative raising children takes their laptop, goes into the caregiver's home, walks them through an application to kind of figure out what benefits they're eligible for. And they have found in their evaluation that peer kinship navigators are much more successful in accessing services for the caregivers than degreed professionals, which is an interesting piece of information there. Also, though, they have this interdisciplinary team. So the degreed professionals who can help the families with mental health issues, with challenges, with any kind of family dynamic issues, and that has been a very successful kind of combination for Florida. So as you see, they kind of have this wraparound program. And we're happy to connect you with these people. They're very helpful. The evaluators from Florida have had some ongoing talks with Washington, and they are helping them out. Now, what is preventing them from the well-supported is they need a manual. So they actually really need a manual for anything. So they need that manual, and they're working on it, and they hope to have it done shortly. But the evaluation that they do have out there has shown really promising outcomes, and you can see them here. And it's really interesting, the cost savings piece, and that's something to take to your legislators and your heads of your agency. The second program is quite different. Ohio is one of the first states, along with Washington, to have had Kinship Navigator programs statewide, or almost statewide. And what Ohio did was they had a line item in their budget for Kinship Navigator programs, and each county had a set pool of money, right? And then they were all tooling along with their Kinship Navigator programs. They were a national model. We were always pointing to them. But then the money got not line itemed. It got put in a big money pool. And so a lot of states stopped doing it because they didn't have to. So now what we have is only 3 or 4 states doing kinship navigation. One of the most successful is this Richland County. It's a real rural county. It is housed in the Child Welfare Agency, and this is one of those exceptions. It's a very rural county, and the man who is with the county Child Welfare Agency is a huge kinship advocate. They all consider him very close friend and ally, and there's a lot of trust there. So they had housed the navigator in this building over here. They'd rented it, and they'd had it off-site. But then they surveyed their caregivers and said, would you come to the Child Welfare Agency if we housed it there and saved this rent and put it into services? And they answered yes. But it's a very, kind of unique situation with this man who's going to retire soon, so we'll see what happens then. But they provide all these kinds of services, very one-on-one as well. Now, their evaluation is tied up with their waiver. Ohio's had a waiver for many years, and they really use it to kind of fund soup to nuts. And it's not clear if they're going to evaluate their navigation program separately. So we'll see what happens with Ohio. But hopefully they will, and we're staying in close touch with them. And then I'm going to conclude with Washington State and turn it over to these ladies. But Washington State has had this program that started with Casey Family. It's been around for about 15 years. It's been very successful. We point to it nationally all the time. They're real people, real caregivers who are, providing hands-on navigation to other caregivers. They do all these kinds of things. They also have a state pool of money of $1 million, which they can help caregivers with, kind of emergency needs and needs like beds, cribs, bedding, whatever, that for these folks that weren't planning or expecting to raise children, right? So they should get some help. You can see their website link, which links to all their wonderful resources. And now 8 tribes also have Kinship Navigator funding from the state, but it's limited. And apparently they don't have quite all the same resources. But I will leave that to Cheryl to tell you more about. But that's what I heard from the state. And what is stopping them? Why are they not fully evidence-based yet? It's because of a control group. They don't have a control group. So they're working on figuring out what would be reasonable. How do you compare, people who are getting services and people who aren't getting services in a reasonable manner? And they're working hard on that with a lot of good researchers and evaluators. But you can see from the evaluation they had about 13 years ago that they had some great outcomes, and they continue to have great outcomes. And I am going to turn it over to Lynn to tell you all about how it really works.
I don't care. So my name is Lynn Urvina, and I'm a Kinship navigator that I'm based in Olympia, Washington, and I work at a nonprofit called Family Education and Support Services. I've been in my position for 10 years now. So in our state, the program was already up and running when I got a chance to take this job. Excuse me. And the reason I got involved with the Navigator program is I am a kinship caregiver. My husband and I took in one of our granddaughters when she was just 11 months old. We started with custody through the courts. We're, I think, similar to a lot of kinship families in that we originally contacted CPS and shared some of our concerns, and I guess, I don't know, I just couldn't light a fire under them fast enough, and I was really worried about this child, and so we went through family court and were granted non-parental custody. And that was a process that took about a year and more money than I want to talk about, but it kept this child outside of the formal system. Several years later, when she was 8, we were able to adopt her, and that was just because at that point both of her parents agreed. And she's now 14, very 14, but she's a wonderful young lady. And I'll have to tell you, just a few days ago, she was talking about what she wants to do. Teenagers think they have to have it all figured out. Well, most of them think they do have it all figured out, but I said, you don't need to make up your mind now what you want to do. It's time just to think about lots of different things. And I said, I didn't know what I wanted to do until I was way older than you. And she goes, yeah, I know. You can say thank you to me, because she knows she's the one that helped me find my all-time what I wanted to do when I grew up job. So she gets it that I'm here because of her. Along the way, we also had one of her half-siblings, who's also a granddaughter of ours, placed with us through the department. So I've had that experience also. I'm yet to be a licensed foster parent, though. And to be honest with you, that's not my goal. So I really enjoy the fact that I get to work with a lot of families under similar situations. And one of the things that I've learned, and I really would like to emphasize for any of you that are looking at moving your programs forward or starting a program, is that it takes a lot of collaboration and a lot of partnerships with a lot of different people and different agencies to make it work. And on the website that will be on as PowerPoints, our state DSHS has a kinship caregiver section of their website, and it lists lots of resources. So sometimes I can physically give people the printed material, but if not, they can, if they have access to the internet, they can go online and they can find out about all of these different resources, whether it has to do with TANF or medical coverage or childcare. Most of the time when I hear from relatives to start with, they're in some sort of crisis. Maybe the children were just brought to them by mom, and she was, going out for a few hours, and actually that was 3 months ago, that kind of thing. So they don't know where to turn. Most of the families I work with are not relatives who have their children placed with them by the department. However, navigator services in Washington State are available for anybody, including fictive kin. Some of our programs within the Navigator umbrella have some very specific parameters, and that does include the financial support. And unfortunately, we used to be able to help the fictive kin with financial assistance, and currently that's not allowed in our program. But we certainly can help them with other resources. We have quite a few who attend support groups, and we can help them in a lot of different ways. So some of the other partnerships have to do with places where we do hold our support groups. I think short of emergency financial assistance or giving some emergency, and I can't give legal advice, but I can refer them to free legal clinics, or I can explain how it works in our counties. I don't know about the state you come from, but in Washington State, we all have the same family law, but depending on what county you live in, it might be carried out slightly differently, or the process might look different. Trying to be correct here and not slam anybody, but some counties do things really different than others, and it helps if you have an idea going in, maybe what's going to work. So I try to refer folks to the best place to get information, but the support groups are where they realize that they're not the only ones in this. I mean, we've seen all the numbers, and we know that there are many, many people providing kinship care. In Washington State, there's 43,000 children living with kin. Some of those may be within the system. A vast majority are not part of the child welfare system. So if they're not part of the child welfare system, they don't have anybody else to tell them what might be available to benefit their children or themselves. And at support groups, they'll see somebody else who, I hear this a lot. They'll tell their story a little bit about their adult children that have gone sideways. And one thing I haven't heard a lot about today so far is it's not normally just substance abuse disorders or challenges. It's almost always paired with some sort of mental health challenge also. That dual diagnosis is so common. So we'll have, a caregiver that might be open and sharing their story a little bit, and this new grandparent will say, "You just described my family. Are you sure our kids aren't the same person?" Because their behaviors are so similar, and they realize, okay, I'm not the only one that tried really, really hard, but my kid made their own choices and left me with the only thing that I can do, and that's to step up and take care of their children. So when they realize that there's other people in that same situation, I just kind of see some of the weight lifted off their shoulders. They certainly still have challenges, and a lot of them have to do with the behaviors of the children in their care. If children have been exposed to early trauma, and if they've been exposed to drugs in utero, it's often difficult to parent them in the same way you might have parented other children. Most cases, it's impossible to parent them in the same way you've parented other children. So that's something that I also try really hard to connect people with, is the resources. As Anna was mentioning, we have a variety kind of wraparound programs, and some grandparents I still find are very suspicious of any mental health services. They still, many of them operate with the idea, well, I don't need to go to a counselor, my kid doesn't need to go to a counselor, we're not crazy, it's just that they behave this way, and so sometimes it's a matter of connecting them with someone that they are comfortable with, because in most communities, there's a variety of providers that have different types of services. One of the things that I know is important to me in my job as a navigator is knowing what's in the communities I serve. And if I chose to, I could spend all of my hours in the 3 counties that I serve just trying to figure out who all those people are. And so it is important to have that be built into the program, that navigators have time to attend community meetings. They're probably called different things in different areas, but one of them that I I went to because my boss asked me to go. I didn't have a clue what it was, but she couldn't make the meeting, and she said, well, you go fill in for me. It's called our Local Planning Authority, and it's a combination of some state folks who work with TANF clients, our local community college, and other agencies that all serve low-income families that are on TANF. Now, when I go, I'm always asking the question about, well, does this program work for families that just have child-only TANF? Sometimes yes, sometimes no. But the benefit of being at that table is I know who the supervisor is at the TANF offices in my 3 counties. And if one of my families, and most of them do have questions about TANF, luckily in our state it was just some laws were changed that make it more available to our caregivers, and they even got a little tiny increase. Of course, they're losing their food assistance because of it. But anyway, I can either email or pick up the phone, and I can call somebody who can look at that case. They don't tell me. They will contact the caregiver. And sometimes it's just a matter of explaining what the law is and why they can't be served. Or it's happened more than once that they've realized that a worker's hit the wrong key, made a mistake, something, and they are eligible for benefits. So the fact that I can kind of connect these 2 people, I think is important. And it's much, I know as a person, if somebody just says, well, call DSHS and ask them. I'm like, that's our Department of Social and Health Services. First of all, the only one number to call DSHS, you'll probably be on hold for about half an hour. And I don't know who I'm asking for. And so if I can tell people, here's the name of somebody, here's the phone number. And by the way, she doesn't work on Fridays, so call her, and it's best to call her at 9 o'clock in the morning. They're more likely to be successful in finding the resources they need for their children. So I think that's a big part of what I do is making those connections with people. Back to the legal bit, often relatives are trying to decide, should I get custody? Or they'll call me and they'll say, well, I have custody of my grandchild, or I have guardianship, and there's so many different terms floating around. I usually say, so explain to me what that looks like to you. Most of the time it's a piece of paper that mom wrote on. If they're lucky, they got it notarized. But that really doesn't carry, in Washington State, that's not a legal document. It's helpful, and it's better than nothing. So we're fortunate that we have a publication in Washington called Legal, it's put out by Legal Voice, and it's options for grandparents and other relative caregivers. So it's written for those of us that did not go to law school, and it explains the difference between guardianship, non-parental custody, adoption, and RGAP, and all those different things so that they can look at that and make some informed decisions. I think one of the biggest complaints is people don't know what's out there. A lot of them don't even know there's a navigator, and many of them don't know the different programs that are there. So our main job is to help them find out what is out there and to let them decide what they want help with. Because our model is not punitive. We're not going to tell them what's wrong with their family, what they have to fix. We ask them, what can we help you with? And then we try to connect them with those resources. And some of our navigators in Washington State are kinship caregivers. Some of them aren't. Many of the programs have a combination. And just throw it out there, as she put out there, only 30 of our 39 counties have navigators, and it's a total of 7.5 full-time positions. Remember I said there were 43,000 kids in care? So there's a real issue with access to the navigators, even though we have them. So the more navigators that are able to serve families, the safer and more stable these kids will be. So thank you. No, we're paid, but like most social service jobs, not necessarily the highest paying jobs in the world. But in my position, it's a very flexible job, and it works really well with having a child at home. And I love what I do. So,
What about that bridge? I'm sorry, can I ask one more question?
I was going to suggest this, we go ahead and
I'll talk really quick. Oh, they did? Okay. Well, hello, my name is Cheryl Miller, and I'm the Children and Family Services Director for the Port Gamble-Sklallam tribe located in Kitsap County. We're a small tribe, but we're a very progressive tribe. And just a brief background about our own department. Under Children and Families, we have TANF, Child Support, Elders, Youth, Vulnerable Adult. We were also the first tribe in the nation to have direct 4E funding, and we're currently the only tribe that has a 4E waiver. So we also have a campus-like setting. All of our services are pretty centrally located to make it really client-friendly. The health clinic's close, education department's close, and it's walkable through the whole campus. So we had children and families children and their families has always been a great priority for Port Gamble, and they're really progressive and go after any funding that they think will help their families succeed. So in June of 2016, we had an opportunity to apply for state funding for Kinship Navigator funds. The first year it was a $50,000 pot of money. This last year it was $25,000, and now it's gone back up to $50,000. So I submitted a proposal in June of 2016 to the Department of Social and Health Services area Aging and Long-Term Support Division is where we got this funding from. So, and it was essentially, we wanted to develop a culturally competent response to Kinship Navigator and respite services, and that would allow us to enhance our service to our families and provide them with additional support and resources. So some of the goals that we outlined in our proposal were assisting kinship caregivers with locating and understanding the available support services for them and the resources that could benefit the families, connecting and referring kinship families to the appropriate resources and advocating for them when necessary, and expanding our Kinship Navigator program through culturally relevant programming and Port Gamble-Sklallam cultural values and traditions. So we have a great child welfare team. I have a family services program manager and two what used to be called ICW caseworkers. We changed their name to family care coordinators to get rid of the stigma of ICW and to make it more family friendly and client focused, because there was such a stigma in tribal communities about ICW that this helped us try and form better relationships with the parents that we were working with. We also have, we are able to license our own homes. So we have a tribal elder in the foster care licensor position. She's a retired chemical dependency counselor, and she's grown up her entire life on the Port Gamble-Sklallam Reservation. And so we had her in our foster care licensor position, and we moved her to take on the additional duties of the Kinship Navigator program as well. She knows all of the families that live and reside on the reservation. She knows their backgrounds, and they're familiar with her. She's an auntie, a grandma, a respected elder to most of them. So we felt by pairing her in this position that she'd be able to go into the homes more freely and really connect with the families, which is exactly what she's been able to do. So we were able to hit the ground running because I've got such a great team to start providing services. We projected that we were going to try and help about 35 individuals for the first year of funding, and we also used any means necessary to get out. We developed a brochure, we advertised in the tribal newsletter, we had community meetings. Every chance we got, we talked about this program. And this program, since we already had a number of contracts in place with outside agencies and also our own behavioral health program, we were really able to connect folks to the needs that those little gaps that could make them either succeed or not succeed. Our other goal was to try and reach the families that were borderline becoming into the foster care in the court system, which we wanted to prevent. Port Gamble, we were already doing prevention services, but now we had extra support and extra money to back up those services, rather than use tribal hard dollars, which are at such a premium. And this, one of the things that we used the tribal navigator funds for is we have a grandma raising two of her grandchildren. She hadn't expected to keep them for as long as she's had them, but you know how that goes sometimes when you've got a parent who's involved in drug and mental health issues, just like you just did. One of her grandchildren, her grandson is confined to a wheelchair. He's got spina bifida. And he's growing up, he's becoming a teenager. And to get him to learn more self-sustaining, how to take care of himself and stuff, we were able to install a shower for him. So Grandma didn't have to help him shower anymore. And we were able to do that with the Kinship Navigator funds when we couldn't previously use a number of our funding sources for construction. Even though we could clearly state how this was to help this young man be able to care for himself where Grandma didn't have to do it. And as he gets bigger, Grandma couldn't lift him. So now he can just go right into the shower. This funding really has been a godsend for the tribe. We were able to use it to help with rent when a grandma or an auntie took some children to get a bigger home that otherwise she couldn't have taken these kids. It's been able to help us work with the parents. I can't tell you how many parents we've worked with to help them correct any parental deficiencies or little struggles that they were having that were little to begin with but could have blown up to be really big problems, and it kept our kids out of care. I started to go so fast I forgot where I was. All of them, the Kinship Navigator, since she is our foster care licensor, she works really well with all of our family services team. We have, with our waiver, we've developed a positive Indian parenting program using Sklallam values and traditions, and it's specific to the Port Gamble Sklallam tribe. And we also do FGDMs, family group decision making, and we also have a CPT team. So we really do a collaborative approach to all of our child welfare clients. And the plus that we get from the tribe is that we know all these folks. You see them in the community, we talk to them, and you're really invested in their success. So I just can't say enough good things about the program and how you can really tailor it to meet the needs of your community, especially your tribal communities. It's just been wonderful for us.